Thank you, Radha. Awesome. All right, great. So let's start. Great. Hi, Tanima. Good to see you. Everyone, good afternoon. Welcome to Atma Webinars. I'm Vaishali. I'm a senior consultant at Atma. And since 2007, Atma has been supporting NGOs as you all know, in organizational development and creating systems and building capacities overall. The Atma webinar series was started in 2017, where we have speakers from different expert areas where they come and share practical experiences and knowledge that can benefit us all in the NGO sector, right? So we cover various OD areas like HR, finance, fundraising, communications, and you can find all of it on our YouTube channel. All of them are recorded and uploaded over the last 3 to 4 years. I also want to mention the intermediary database that we have. If you have not gone through it already, it's a database of verified uh, uh, people just like Dr. Vinti who are offering services for for NGOs. And yeah, without further ado, I would like to introduce Dr. Vinti now. In just a minute. I know she doesn't like it much, but it would be good to know who's here. And trust me, we're in very good hands today. Dr. Vinti has over 2 decades in academia and nonprofits. She specializes in economics, finance, and data analytics. She has taught diverse subjects and led research across state finances, autonomous bodies, microfinance, health communication, early childhood development, you name it, she's done it. Also includes maternal health, primary education, palliative care, financial inclusion, and so on. Right? She's extremely experienced in MEL systems, impact evaluation, and mixed methods research with a gendered lens. And she also now advises grassroots organizations on research and assessment strategies. Right? She's a strong advocate for mental health and spirituality, and she also volunteers in statistical consulting. So just before we start the webinar, some ground rules. It's a request to all the audience members to put your questions in the chat box. आपके अगर कोई भी सवाल होंगे तो आप chat box में डाल सकते हैं. हम हिंदी और इंग्लिश दोनों में कोशिश करेंगे. बट बहुत सारे साथी हमारे साउथ इंडिया से भी हैं, नॉर्थ ईस्ट से भी हैं, जो इंग्लिश प्रेफर करेंगे. लेकिन अगर आपको ट्रांसलेशन की जरूरत है हिंदी की, तो आप चैट बॉक्स में पूछ सकते हैं. एंड आई विल ट्राई टू मैं कोशिश करूंगी कि की पॉइंट्स को समराइज कर दूं. इट्स अ रिक्वेस्ट टू एवरीवन टू शेयर your questions in the chat box, and towards the end we will have a proper Q&A as well. I mean, dedicated time for that. But till then, if you can add your questions in the chat box, then we'll make sure to address as many of it as possible. All right, great. With that, I hand it over to you.
Okay. Thank you so much, Vaishali, for that lovely introduction. And as I said, I feel always very embarrassed when somebody tries to introduce me. But nevertheless, so when I and Vaishali were discussing the possible choices of topics, so Vaishali came up and said that, we'd like to do something on indicators. Now, so we talk a lot on a lot of stuff regarding MEL, but the discussion around indicators does not always come through. So for a change, we decided that, let's look at indicators, because given that, fundraising is a difficult path, and a lot of donors will focus a lot on your theory of change and your log frame model, and of course, lastly, in terms of your indicators. So we try to put together something, okay, and we'll take your questions at the end. And we also have checklists, and we also have a small indicator readiness tool, which we'll request you to fill up at the end, okay. So let's just first look up in terms of like what and how do you define an indicator, right? So there are many definitions of indicators. Like, for example, the most important, as I would say, is the OECD one, which says it is a quantitative or qualitative factor or variable of interest related to intervention and its results and to the context in which an intervention takes place. Now, as you see that you can say it's both qualitative and quantitative, right? So basically, the idea of an indicator is that it should be able to measure change, okay, and it should be able to measure progress, which can be either an activity or a project or a program, okay. And obviously, if you look at the European Commission's definition, it also mentions something as target groups, time, and place. So if you combine all these definitions, you will basically look at a couple of things. It can be either quantitative and qualitative, measuring change, progress of an activity, project, or program, and in terms of either quantity, quality, target groups, time, and place. So when you look at indicators, you need to look at all these into consideration, okay? Now, why every nonprofit needs an indicator dashboard, okay? Now, the first and foremost is that like all organizations, even an NGO needs to understand and to be able to benchmark its performance. Now, why is the organization in existence, right? So if you want to justify your own existence, you need to define your indicators, because without the indicators, right, you will not be able to demonstrate either scale or impact. So simple for the fact is that why do you even exist, okay? What is it that makes you tick? For that, you need indicators. Then you need, for your meeting your donor community requirements, all your donor communities will want to know how is it that you're assessing performance? How is it that you're assessing impact? And for that, you need certain indicators. Even for your own internal stakeholders, you would need to know in terms of like, what are your operating realities? How effective are you, right? Are you working according to schedule, time, in terms of how your counterparts, in terms of your beneficiaries or your program participants, how are they perceiving your work? And last and most important is building brand image of the organization. Now, I view this as a really very important part, because if you want to attract funds and you want to grow and scale, you have to build brand image. So what is it that you stand for? In that sense, you need to have indicators, because until unless you don't kind of say that, okay, this is what I stand for, and indicators will tell you that, okay, this is what I stand for. So in that sense, right, for all these reasons, you definitely need an indicator dashboard, okay? Now, if I look at this is a typical logic model, okay? And we all know in terms of like, you have outputs, outcomes, and impact. Of course, this is a truncated model, okay? So here we are talking about in terms of when we are looking at this, on each stage, you will have either output indicators, outcome indicators, and impact indicators. If you look at a full-scale model, you will also have something like activity. So you can also have activity and input indicators as well. Okay, so this is the entire logic model that we are talking about. Okay, in terms of just a rehearse of some of the key terms, inputs indicators measure the specific resources that go into carrying out a project or a program, whereas activity indicators detail the actions taken to implement the program. Outputs in terms of the immediate results. Okay, so if the organization is, let's say, carrying, a training program, so let's say, so that would be your output. Outcomes in terms of, let's say, how many people attended the program. Impact in terms of the long-term goal or ultimate objective, which is the reason why actually the organization exists. What is the ultimate change that the organization wants to make? So that is in terms of impact. Now, a lot of people ask me like, what is a difference between a logic model and a log frame model? Okay, so essentially the same. But in a log frame model, it is a more like an operational model for a logic model, right? So where does the indicators actually go? So you will have whatever is like your goal, outcome, outputs, activities, okay? So in this case, you will notice that you have certain kind of targets that are given in terms of your project summary or your targets. And then if you are looking at those, okay, then you will have, the indicators, okay, in terms of like, okay, fine, this is what I want to measure. And if you've noticed, it is in precise terms like percentage, attendance, number, number, okay? And then how are you going to find the information regarding that? Then there is something called a means of verification, whereby you need, in terms of like, okay, how are you going to collect the information related to that indicator? Okay, so for each of these indicators, you need to have a means of verification. And if there are some risks or assumptions that we are taking with regard to formulating those indicators or meeting those targets, then those risks and assumptions also need to be put in this model, right? So the logic model is basically in terms of how you have visualized your inputs, outputs, outcomes, and your impact. Whereas in a log frame model, it is basically your operationalizing of your logic model, okay? So what I did was kind of, because, indicators is a very, really vast topic. So I thought I'll just take you through some, examples of indicators, right? So for example, like health, it has like, okay, so many kinds of indicators, right? So I've just given some, brief examples. But if you look at health and you go to the WHO site, okay, or any other, site which is related to health, you will find, a whole lot of indicators, and within mortality indicators, there will be like 3-4 indicators, morbidity indicators, again 3-4. So there is a whole set of, indicators with related to just health, okay? Now, I've given some examples. This is just for the sake of an example, and it's just, you don't really have to get into it, but this is just to give you an idea that, okay, fine, this is what indicators look like, right? So similarly, you have examples for water use, right? So you have, indicators for water sources, right? So how do you measure, like how good is the water sources, right? So groundwater level development, water purification. Okay, so if you want to measure like the efficacy of water purification, then what is the treatment efficiency indicator? That is, to what extent was the bacteria removed? Water usage, right? So percentage or number of people not served with improved drinking water and extension of pipe water supply. Domestic water use efficiency, agriculture water use efficiency and efficacy, right? Wastewater collection, percentage of wastewater collected to total wastewater production. So these are, so every intervention that you do, right, will have a set of, indicators depending on the sector that you are in. Going further, I actually also further decided that, okay, let's look at some other indicators in some other, so, I mean, as I said, there are like for each vertical, each thematic area, there will be like maybe 10, 15, 20, 25 indicators, which are there, okay, and like they are accepted indicators, okay. But I just like picked up 1 or 2, right? For example, nutrition, like percentage of children born in the last 24 months who were ever breastfed. Access to food, number of individuals able to cover the nutritional requirements. And then you have to obviously specify the number of days or months. Climate, total amount of carbon dioxide, income and employment, average monthly income of employees in the past. Again, specify across the number of months, because obviously it has a time reference to it. Maternal and child, percentage of children aged 0 to 23 months who were born at least 24 months after the previous surviving child. This is basically related to birth spacing. This is related to income, right? Education is basically in terms of your net education, net enrollment. So this is percentage of enrolled child attending school or learning space, right? And this is vocational education. Similarly, women empowerment, there will be many, many indicators of women empowerment. So I've just taken one example. So it's average score on household decision making, right? So please note that they have used average score because this is something that we like to discuss a little later, okay? So I am just going to stop share for a second. Vaishali, any questions?
No, there's just one from Divya. She's asking, while output and outcome indicators usage is evident, when do we refer to the income and, input, I'm assuming input and activity indicators?
So if you want to measure in terms of input, in terms of what are the resources that you've put in, right? And you want to kind of factor that in, then that is input indicators. And if you also want to factor in terms of like what activities you are doing, and you want to actually count that, measure that in terms of keeping a track in terms of how efficient are those activities done and how effective are those, then in that case, then you also need to do activity indicators, right? So we'll take an example later on, and
yeah,
we,
but mainly for monitoring, right? Like for
basically for monitoring. So input, activity, and output is more monitoring, and when you come down to output and impact, that is more evaluation, right? Is that okay?
Great. अगर और कोई सवाल है तो प्लीज चैट बॉक्स में डालिएगा, बट अदरवाइज वी कैन कंटिन्यू मैम.
Okay. Okay. So another great place to, kind of also look at indicators is your SDG indicators, right? So you know there are 17 SDG indicators, and if you go to the website, you can actually download the whole lot of indicators there. What I have done is use just selected ones and, just picked up one or two indicators which, sort of made sense, okay, and which you might relate to. But the whole idea of doing this is that, see, while these indicators have been done in terms of a country context, okay, but you can actually, look at these indicators and look at it in and, center it around your particular locality. So if you actually want to start your, intervention and look at it, please go back and to the SDG site, look at the indicators for the intervention, because it basically covers all the thematic areas. And that will be something to begin with, right? It will give you a good idea of how you can actually tie your indicators to SDG indicators. So this is a great place to kind of, understand like what are the development considerations and how you can formulate indicators for your particular thematic area, right? So I have done it for some, things. I won't read out what is written on the slide, but the whole idea for you is to be able to, understand that this is one area where you can actually inform your intervention. Okay. Now, a lot of people will always, feel that, indicators only have to be quantitative. While I agree that, quantitative indicators are best in terms of being able to very accurately measure. But it is not to say that qualitative indicators are not important and cannot be used as an indicator, right? So while I say qualitative indicators reported as like units, prices, proportions, rates of change, percentage, ratios, right? So all in terms of numbers, anything that you are quoting in terms of a number, then that is a quantitative indicator, right? Whereas qualitative indicators will always be reported in codes, statements, descriptions, case studies, right? So those are also there, and those can also be part of your log frame model. Okay, so you can always say that, okay, this is also an indicator, and this is how you are going to measure that. Okay, now each of these indicators have their like strengths and weaknesses. Okay, so quantitative, yes, number. Qualitative, then it is, if it is not quoted in numbers, then it is qualitative. Okay, and both are needed in a project or program, right? So if I do a detailed case study on changes in individuals' livelihoods, but if I don't do something in terms of like how many people were supported, then that is incomplete. But if I just put, okay, that I reached X number of people, okay, or, I was, able to, provide this kind of benefit to, Y number of people, but I don't really say that what is it that actually changed their life? Like, how is their life changed? What is the process of change? So there, the qualitative part is really important. And in the development sector, we all know that we are always talking about triangulation of data. So in that sense, right, so qualitative and quantitative are both something that, you need to kind of always, carry together. So many times, you will find that in evaluation proposals, we will always look at, doing some focus groups or some in-depth interviews or, key informant interviews. This is because, you have to understand why, even if it's a number, then why is it that number, needs to make sense, right? So qualitative and quantitative, both should be used in conjunction, right? So do not focus only on quantitative. Now, having said this, I do realize that in today's scenario, there is a lot of focus on only quantitative, but without qualitative, quantitative is kind of incomplete. Okay. Now, quantitative obviously needs a lot of statistical data methods, whereas qualitative, in terms of a qualitative analysis. Now, here I'd also like to, stop and say that, most of us tend to think of qualitative only as focus groups and maybe interviews and stuff, right? But there are a whole lot of qualitative methods also which you can explore, which also give you rich, information and data, which you can also use as an indicator. So qualitative should not be just, only these 2-3 methods, but, if you actually explore qualitative and push the envelope, there is quite a bit. And similarly, quantitative also, even sometimes qualitative can also be converted into quantitative. For example, you have checklists, right? You have observations. So it can be coded, and to some extent, it can also be analyzed in through numbers. Of course, the sampling part, obviously, in terms of the total range of the number of, people that you have impacted may not work through, but at least you can, have some quantitative conversion of your qualitative methods. Okay. So the only problem is qualitative is that may not be representative of the entire population. Okay. Whereas in quantitative, whatever data that you do give it needs to be justified, and that justification happens through qualitative methods. Okay. So if you are doing, right, employment rates or income or whatever, right, then quantitative. But if you want to figure out like how the program worked, right, how did it impact people, like what are the challenges or whatever the issues or whatever the risk or, some of the assumptions, that might be challenged. So for all that, you need qualitative. Okay. So what we are going to do now is we are going to take a small example. Okay. And we'll, walk through this, and I want you to kind of, give your responses in the chat box. So this is a made up case study. Okay. So, but, so for example, in this case, what I've taken up is that there is a large percentage of children in grades 4 and 5 in government schools, which were not having basic literacy and numeracy skills. So because the schools have automatic promotions, the children are advanced up to the 4th grade, but they don't have the requisite skills which are associated with the first 4 grades. But the moment they reach the 5th, then they kind of lose interest and they drop out or get, because the teachers don't want them in class. So this makes it harder for the children to learn, because the teacher needs to devote time to remedial classes, and she probably doesn't have time, and especially so in government schools where the teachers in any case don't want to spend time. So in intervention, so what we have done in this case, we are giving remedial classes through community trained teachers who have passed their 12th class. They are paired with a group of students to help them in mathematics, English, and Hindi, right? So this is the basic intervention, okay? And now what I'm going to do is, we'll take each of these, activities. I just want you to be able to, because then we'll go on to the indicators with reference to them. I just want you to be able to classify them as either activities, outputs, and income. So I'm going to stop my share. Okay. No, I won't stop my share. I'll stop. Okay. Yeah.
Yeah.
Right. Can you all see my slide?
Oh, now it's gone off slideshow.
Okay. Yeah, but it's gone off slideshow because I wanted to see the chat box. How do I see that now?
Usually you can toggle. You press the
alt
tab, you should be able to. Otherwise, I mean, the chat box can also pop up on your slideshow.
Okay.
Otherwise, I'm here. I can also check and let you know what is coming.
So what I'll do is I'll stop the, I'll still go back to my slide share. Okay. Right. Can you still see the slide? Okay.
Yes.
Okay. I
think one answer has also started coming in.
Okay, great.
So like, let's take
identification of children who need remedial education.
Tanima and Dr. Ratna said activity. Would encourage everyone to share.
Okay, so it ideally should be activity.
Yeah.
Identification of female community teachers who can take remedial classes.
Yeah. Divya has also said that A, B, C all are activity.
Okay, great. So ABC is definitely activity. Master trainers are hired to provide training to community teachers.
What about D? Great, Radharaj. Yeah, everyone's been identifying it as activity A to C. D
Okay.
is also activity. It's coming in as activity.
We can take
Dr.
it.
Ratna is saying D is inputs also, maybe.
Yeah, you can do inputs, you can do also activity. So yeah, fine, it's okay, fine.
Okay. But Radha has said D as outcome, but I think definitely it's an activity or an
It's
input.
an activity, or you can say input, right? So, but yeah, it ideally should be activity. Okay. Remedial education is provided to students.
E. Okay, here there is a lot of like different answers. Okay, for remedial education is provided to students. Some have said also an activity, some have said input, some have said output, and few of them have said out.
So
here there
ideally
seems
it
to
should
be
be output.
Yeah.
Okay. Remedial syllabus and evaluation plan is prepared.
Yeah, I hope everyone understood that remedial education being provided finally is an output level work, right? So all of you answered output. You're on the right track. Great.
So remedial syllabus and evaluation plan.
That is coming in as input and output के बीच में answers आ रहे हैं.
हाँ, ठीक है. It should be either input or activity, right? But not necessarily output. Okay.
Yeah.
Okay.
F is also an
student
activity.
dropouts reduce.
G is outcome. Okay. There is one question, ma'am. Could you explain why E is an output, which is remedial education is provided to students? Why is it an output?
Because you are performing the activity in the sense, and it is benefiting the whoever are the participants, right? The end participants. Right. So to that extent, you are doing it, but it is not necessarily something that they have benefited out of it, right? So the quality of what you are doing, if definitely you have done it, okay, it's something that eventually that you have provided to them in that service, but you can't classify it as an outcome because we still don't know what is the impact of that particular activity.
So
yeah, I hope that was clear.
No, sure. So I'm not trying to differentiate between output and outcome. I'm trying to understand, why is it not considered an input or an activity? Why is it considered an output?
It's considered as an output because ultimately this is what you were meant to do. Right? This is how you are, trying to, provide, benefits to the end consumer, or end participant.
So I have a
now, yeah.
So, like, on what level we are deciding this? This comes in activity output or what? Based on beneficiaries or based on
so ideally anything that is eventually done in terms of reaching out to the end, target participant, then yes, you should try and look at it in terms of that, like, because that in that sense the service is actually being provided. The intervention is actually gone into place and you are actually delivering to the end participant.
Yeah, got it. Thanks.
Okay. Students can, student dropouts reduce. Okay, everybody said outcome. Okay. Students can pass grade 5. That should be outcome. Okay. Students lead more healthy lives and exercise healthy choices. Impact. I think that should be more impact because you are looking in terms of a longer term sustainable aspect, right? So you can say long-term outcome and you can also say impact. Okay.
Impact. Yeah.
Students given remedial education, completed high school and secured employment.
J, I think, again has come in as impact or outcome.
Yeah, it should ideally be impact. So if you say long-term outcome or impact, it's both, it should be okay. Okay. Then community teachers, one sec, sorry.
Community teachers are trained on remedial syllabus.
One sec. Again, I think I've lost something.
No problem. People have written in as output.
Okay. Okay. So community teachers are trained on a remedial syllabus. Ideally, it should be activity. Okay. And community teachers show increased confidence in their teaching abilities.
What would L be? Rahul has written outcome. Shubhra is also saying outcome.
Right. But if I say M, community teachers report increased agency in their lives. Okay. I would probably take this as an impact because this is more long-term in nature.
Yeah.
Okay. And students report better grades within existing class. This is also outcome. Okay. So the whole idea of doing this is, get a sense of like where we are in terms of like outputs in, activities and incomes. Now the whole part of doing this is now let's look at what are the possible indicators. Now I have put some indicators, right? Now it is, I'm happy to, hear from you guys what kind of indicators you want to put. Okay. So I have put some, but this is not the universe. Okay. So I have said identification of children who need remedial education, right? So what I have done is number of children in classes 3rd, 4th, and 5th lagging behind respectively in English, Maths, and Hindi disaggregated by gender, right? And of course, I've done further breakup by school, locality, income status, parents, occupation, right? So feel free to, put something in the chat box, okay? And Vaishali, if somebody puts in the chat box, because I can't see the chat box, right? So please kind of do that. Similarly, identification of female community teachers, right? So I have put it in numbers, number of teachers living within 1 kilometer radius, right? And even within this particular indicator, right, you can always, put in some more detail, right? So I've said number of teachers living within 1 kilometer radius, okay? Now you can say break up in terms of like only 12th class or BA, right? Or you can also say, 12th class in science or commerce or English, in whatever, like in terms of whatever stream. So it's again something that you have to think in terms of, okay, this is the indicator. How can I refine this particular indicator given what I have? Okay. Then identification of locations where these children can be taught. So I have written number of locations identified with adequate facilities. So you can do number of locations and you can then, also classify the locations, right? You can refine it. Then master trainers are hired. Okay. Now I have done master trainers disaggregated by discipline to teach community teachers, right? Again, this is something again that you may want to, further disaggregate. Then remedial education is provided to students. Okay. Then this is number of remedial classes conducted for different subjects as per grade. Total number of hours of remedial education provided per subject per grade, right? Again, you have to think in terms of, is there something that you would add? Is there something that you want to refine? Is there something that you want to change, right? Totally up to you. Remedial syllabus and evaluation plan is prepared. Okay. Now this is something in terms of a qualitative. Okay. Remedial syllabus and evaluation plan prepared for each class and subject as per NCERT syllabus. So this could be something more qualitative, right? And you could kind of look at, to what percentage it is benchmarked as per NCERT syllabus. Okay. Then student dropouts reduced. Total number of dropouts for each class disaggregated by gender. So I have actually done dropouts, right? So I want to see like, okay, before and after. So I have said percentage of reduction in dropouts due to the program, and again disaggregated by gender, because I really want to see whether I have been able to reduce dropouts more in the male children or in the female children. Then there is, okay, total number of children undergoing remedial education passing 5th grade. Okay. Then percentage change in children undergoing remedial education passing grade 5. So I want to also look is that, okay, one is the total number of children, right, who were able to pass grade 5. But because I want to look at before and after that, therefore there was a baseline and an end line, right? So before, how many percentage of children were passing, right? And after that, after they had remedial education, then how many, passed? Was there any change in that percentage? Because I want to really see that whether my intervention actually made a difference in the percentage of children who were able to pass grade 5. Now, this I lead more healthy lives and exercise. Now, while I have said number and percentage of children reporting improvement in health and ability to exercise healthy choices, I also want to focus is that what do I mean by healthy lives and exercise healthy choices, right? So I am just leaving this as a thought process in your mind, because when I say healthy lives and exercise healthy choices, what exactly do I mean by that? Okay, so this is something that we will park for now, but we will discuss it later. Okay.
There is some Divya also has added in, and also would request everyone to share. Right. So for B, they were saying that the indicator can also be number of women in 1 kilometer radius who have completed graduation.
Yeah, absolutely.
Yeah, amazing.
Right. So the whole exercise was that, look, it allows you to think and see what you want to change. Okay. Then students given remedial education completed high school and secured employment. Okay. So here I put 2, number of and percentage of children given remedial who completed high school. Right. And then I have said number and percentage of children given remedial education securing employment of at least 8,000 per month. Now, I could have added also something like this is, number of girl children who were able to delay marriage, right? Or who, the late marriage by at least like who got married after age of 18, right? So reduction in child marriage. So this is another one thing is that because of remedial education, I was able to delay the age of marriage. Okay. So to that extent, these are a couple of other things that you could also have added. Then community teachers are trained on remedial syllabus. So number and percentage of community teachers identified who finally completed remedial teachers training. Okay, so that is one thing that, okay, fine, they were trained and they finally completed it. Okay. Now, the community teachers showed increased confidence in their teaching abilities, because earlier they may have or may or not have been doing anything. But now the fact is that, because they completed it, so now, and they started doing it, they actually realize they have confidence in that. Now, how do you, again, this is something, again, I want to increase confidence. Now, what do you mean by increase confidence? How do you measure confidence? Okay, so this is something that, because this is not something which is directly measurable. Okay, just because you ask, are you confident? No, it doesn't work like that. Okay, so this is something that we will have to figure out. Okay, similarly, number and percentage of teachers who reported increased agency. What do I mean by, agency? Okay, so this is another thing that I will need to kind of define. And students report better grades within existing classes. So this is again something in terms of change in marks from baseline to end line, where at baseline, you evaluate them, and at the end line again you evaluate them. So you need to have a evaluation system that is there, which can kind of look in terms of that. And again, while I have put indicators, not necessarily that because I am giving remedial education, I may not know what their marks are there in school. So I may have put that as an indicator, but I am not very sure that I will be able to measure that, because the grades will happen in school and I will not have access to those grades. Okay, so those are limitations. Okay. Do you want me to stop, Vaishali, or shall I keep going?
Yeah, no, so there is, again, somebody else has, Divya has also written that for I could indicator also be reduction in illnesses. Right?
Yeah, absolutely.
Yeah. And again, I think it all depends on.
It could be also to do mental health.
Yeah.
Okay, it could also be in reduction in, alcoholism and drug abuse.
Yeah.
Right. So, right. And again, it depends on the intervention.
Yeah. I think, and then and Shubhra has a specific question regarding their program, and where their indicators, it's a complex system that they're working on. So should we take that up a little later?
Yeah, we can take that up a little.
So but Shubhra will definitely take it. So okay.
Okay. So shall I continue, Vaishali?
Yeah. Everyone else, you can share do a thumbs up. Let Dr. Vinti know if we can move on. If there are any questions, अगर कोई सवाल है तो please पूछेगा. All right, I can see a few thumbs up. Awesome, great. Okay, because I can't see the chat box because I'm on. Yeah, no problem. I'll manage that. Yeah, if it is, if the pace is, if you need any more support or changes, please do let us know. But yeah, otherwise you can continue. Okay. Manoj sir has also shared a question. We'll come to this, Manoj sir. Yeah.
Okay. So in terms of like, okay, now, you've understood what indicators are, right? You've also understood in being what qualitative and quantitative. Okay. Now the question is like, when you are actually formulating indicators, like how do you go about it? Okay. What are your, things that you have to keep in mind? Okay. So first is that, please, whatever, intervention that you're doing, try and do your theory of change and do it rigorously and actually use research. Okay, so a lot of us actually formulate our theory of change and we don't do research. Okay, and you need to understand, okay, that if I am doing my theory of change, okay, if I do this, then this will lead to this, this will lead to this. So the pathways of change need to be understood very nicely, because without that you can't possibly say that this is what I'm going to achieve. Okay, so the document, and you need to document the pathways of change, and also like make a whole list. Okay, these are your activities, do it in detail, don't just skim through it. Okay, dissect it. Okay, these are my activities, these are my inputs, these are my outputs, these are my outcomes, right? And then you are not the only one in the universe. I say everybody wants to think that I am the best. Okay, I am doing only this, but there is a whole universe around there, and many people may be doing exactly the same thing, or maybe even minor variations what you are doing. So it's good to understand from other people, right? See, you may be looking at the same mission statement, but the approach you may be having may be slightly different, and the other person's approach may be slightly different. But try and understand their intervention, see what variations that they're doing, so that you understand if you are getting some results and the other person is getting some results, why is that happening? Okay, then see, something is very clearly measurable. Okay, this is what I can clearly measure. Okay, fine, that is fine. You need to explore that. But there are things which are not measurable, which are not explicitly measurable. Then you need to see what can be made measurable. Okay, and for that, please explore both qualitative and quantitative, right? And qualitative, as I said, there is a whole universe. Quantitative also, there is a whole universe that you can do and you should do, right? See, earlier we talked about emotional IQ, intelligence, right? Resilience. See, these are all, these are all scales. These are all, facets of human behavior, which we never thought we could measure. But today we have everything, right? Even for depression, even for anxiety, even for stress, we have things which can, which were considered to be qualitative, but now have a quantitative metric. So which means the possibilities of even things which are not so like easily like definable can be made measurable. Okay, and then ultimately you have to decide like what is it that you want to monitor and what is it that you want to measure in terms of evaluation, and why and how. Okay, so this is really important. Okay, so I've just like, everybody does understand, everybody in this class would probably understand what is the difference of monitoring and evaluation, but I've kind of just, sort of given you a kind of thing that, okay, monitoring is an ongoing process. You do it every single day. Okay, but evaluation is in terms of more subjective, and it's about the value of and merit of something that you are delivering. In monitoring, you are doing real-time tracking and early issue detecting, whereas in evaluation, you're doing a holistic assessment or an outcome analysis. Here you are doing routine data collection in monitoring, but in evaluation, it's more intensive. Okay, you need to really deep dive into data, and a lot of it in terms of like very probing questions. Okay, here it is more in terms of enhancing efficiency and seeing whether the service is delivered or not delivered. Here it is looking at what is the benefit, what is the effectiveness, right? And so we have OECD, evaluation criteria, and I'm not saying that every evaluation needs to have all the evaluation criteria, but you should always keep that as a backdrop that, okay, when you are designing evaluation criteria and indicators, right? So you look at relevance, coherence, effectiveness, efficiency, impact, and sustainability. So these are some things that you need to keep at the back of your mind. Okay. The second part is be realistic. Okay. So when I am devising indicators. Okay, so the one thing that you say that, okay, fine, I said, we say that, okay, I empowered people. Okay, but like, what does empowerment mean, right? My definition of empowerment can be very different from that of, the donor's definition of empowerment. And in terms of how empowerment is actually understood may also have a very technical understanding of empowerment, right? Just because I did XYZ does not mean that I have empowered women. Okay, women empowerment is a far more, involved construct, which really requires multiple things to be done, right? So you have to be careful about, how you are saying things, and, and trying to, convince the other person. Okay. Secondly is that you must look at, when you formulate indicators, you must look at your own, records, talk to your own employees, your participants, your other stakeholders, and see what is logically possible, what is feasible in your sense. Like, you should never promise the moon. See that, okay, I have done this, this is my resources, right? This is what I am doing, and this is what I can deliver. Okay. And once, okay, let's say, assume that, okay, you can achieve some outputs and income, and then you have to think about, like, how you're going to track them, and who is going to do that, who's going to do the data collection, right? So I may do something in terms of, okay, that these are the things that I need to collect, but then at the end of the day, I have to also think about, like, who is going to track them, what I need to keep a system. I need to put a system in place so that I can track them regularly, all of which obviously have, some cost implications, right? Monitoring and evaluation, both are necessary, right? So many times, I have come across, and people will say evaluate, but there is no monitoring data. So even if I have to do evaluation through a sample, if I don't have some data in terms of the, number of participants and, some details of the participants, impossible to do evaluation, right? So even for basic sampling, I need some monitoring data and some, some kind of, demographic variables in terms of who are my participants, right? And what is the service that is being delivered, right? What is the, basics of what is being delivered to them, that, and who has got what needs to be at least known before you can, kind of evaluate. Okay. Then the time frame of achievement. Okay. So very specifically, be specific, right? Don't overpromise, because if you overpromise and you do not deliver, then that is worse. Okay. So let's not try that. Then the last part of it, in terms of, like, define your indicators well. Okay. So is it number? Is it percentage? Is it qualitative? Is it going to be a subset of the target population? Is it a ratio, or is it just change, right? So remember, you may need a baseline and end line, and sometimes even a midline. Okay. And indicators need to be tracked over a period of time and cannot be just at a point of time. Okay. Now we talked about, something like agency, right? Empowerment, right? Something like, many times SEL, we say critical thinking, creativity, right? Okay. So confidence, okay. Comprehension, lots of things that we kind of very say that, okay, I was able to increase comprehension. Okay. Now, if I am going to do a construct, okay, that is not directly measurable, remember there is a process, right? If I am creating my own stuff, okay, then it is not a simple, straightforward thing of just, drafting through 4 or 5 questions and say that, okay, fine, this is how I am going to measure confidence. Okay. The reason is that if I measure, suppose I am in this space of SEL, there may be, 5 other people who are in the space of SEL, right? Now, if I am going to do confidence, okay, the other person may be also doing confidence or critical thinking. Okay, then how is my understanding of critical thinking different from that person's critical thinking? Like, what are my checks and balances? So therefore, if you are going to do your own construct, then at least you need to follow a process. And that process is rigorous and requires hard work. Okay. And it should not be done off the cuff. Okay. So that is something. And as I said, I have mentioned these are the stages that are there. It's a technical process. Okay. But, sometimes many of your, interventions may have a intervention for which a validated index or test is already available, right? And it has been translated in the present cultural context. Then, try and find access to it, or try and at least look it up, because, for example, emotional IQ, intelligence, critical thinking, creativity, right? There are validated tests which are available. Okay. And for example, creativity, you have 4 categories of tests, and each of them have something. So look up those and see whether some things can be applicable in your context, right? You can also consider using scores, right? So for example, many times you do something as information or increasing awareness or increasing knowledge or increasing, achievement. You can create, benchmarks and tests, and you can create a score, right? And the advantage of using a score is that it can be taken as a dependent variable, and because it is a quantitative variable, you can actually use it in your regression also. Okay. And there is like, so example, you have customer satisfaction score, net promoter score. Okay. And if you look hard enough, you will also find there are toolkits for community scorecards and citizen report cards. So there is a wealth of information that is there. Lastly, you have, people would like to do something like an empowerment index or a wealth index, right? Of course, there is already an existing, empowerment index. So you look up research, you will find there are many indices. Okay. But let's say assume that you want to do your own stuff. Okay. Now, again, there is a process. Okay. Again, you need to kind of formulate your survey and, put some questions in. And then they have to convert it into dichotomous variables. Sometimes you need to attach weights. And then you run a PCA. Okay. It's a factor analysis command. And then you kind of can do a wealth index or an asset index. So many of you would have kind of done or come across DHS wealth index. So it is created, and each country has a wealth index. Okay, so that's obviously subject to the way you sample and ensure that the sampling is correct. But you can also do a wealth index for, let's say, a section of the population that you are dealing with. Okay. So that is also possible, but again, sampling needs to be done properly. Okay. Now I'm just coming down to some characteristics of indicators. Okay. So they're obviously valid. The first thing is that they should actually measure what they are supposed to measure, right? If they're not measuring what they're supposed to measure, then the indicator is pointless. Reliable, because if you are saying, I'm measuring it, then somebody else measured it, the same, it should be, different people doing the same thing, it should be reliable. Okay. It should measure if there is a change in the situation, then that indicator should be sensitive to that change, right? So that indicator should have the capacity to kind of, change as the underlying circumstances change. Specific, okay. You should be very specific in terms of what you are measuring, in terms of for what particular situation or for what particular participant or particular intervention, right? So that specificity is need to be there. Feasible, obviously, you need to have data. Okay. And if the data is not there, the indicator is not going to work. Okay. And it should be relevant, because ultimately, in the sense is that if the indicator is not relevant to what I am eventually doing as far as my intervention is concerned, there is no point. Okay. Now, a lot of people talk about smart indicators, cream indicators. So I thought I should just at least walk you through. Okay. Specific, we've already done. Okay. Measurable, we've already said that, okay, it should be counted, observed, analyzed, tested, challenged. Okay. So whether it is qualitative or it is quantitative, at the end of the day, it needs to be measurement, because that is why you say sources of data. So if you are putting an indicator, you should be also be able to say that this is my source of data and ensure that data is collected. Okay. Attainable, right? So if you, and at the end of the day, whatever data that you are doing, right, it has to be attainable. It should be within reach. Okay. It cannot be something that you are, put on the Mount Everest and it cannot be done. Okay. Relevant, yes, we've already done that. Okay. And time bound. Okay. So in what time are you going to achieve that? And that is again something that you have to see, because when you look at your theory of change and you look at the assumptions and you look at research, and that, for example, we talk about behavior, that we are going to change people, within 6 months, right? And we know behavior changes will not happen within 6 months. Okay. People may have some knowledge, but behavior change is not something that will happen in 6 months or maybe even a year. So therefore, time bound is really important. Okay. Now, this is something which is looks into diversity and inclusion. Okay. So this is obviously an ideal that we want to do. Okay. So when you say subjective, when you do indicators, also refer to your informants. Okay. And your informants can be either your field people or your program people or even your participants. Okay. And, whatever comments that they make, you may just say it is, just a comment, but, they may actually give a lot of rich source of data and which can actually help you formulate your indicators. People, if you are doing indicators, then when we talk about participatory modes, then a lot of indicators should be done with people who are going to use them. And who are, if you can formulate something which they are part of, then that is the best thing, because then they are in a position to change it. See, the idea is not to only benefit the organization who is delivering the intervention. The idea is to bring value to the person who is, being benefited. So in that sense, if you involve them in the process and they, take the indicator and say, this is going to improve or change their lives, and that's the best thing, right? Locally defined indicators, so it has to be locally context, but sometimes you have to define them in the way that other people may understand them. Okay, then cross-checked and compared, right? So you need to probably look at different indicators and progress and see whether they align with each other, right? So different informants, methods, researchers, in the sense is that see whether it can be cross-checked. Okay, and the process of setting and assessing indicators should be empowering in itself. Disaggregation is important, right? So whether it is gender, whether it is caste, whether it is class, okay, whether it is location, right? All of this, right? This diversification and disaggregation is important, right? So this is CREAM, is basically clear, relevant, economic, adequate, and monitorable. So this is just for the purpose of like, okay, if you want to understand what is CREAM indicator, so it is basically, it has to be clear, relevant, reasonable cost, adequate, and monitorable. Okay, so this is my indicator checklist. Okay, do you have indicators which are linked to program inputs and activities? Ideally you should have, because if you want to look at efficiency, okay, of your effectiveness of your program, your efficiency of the way you deliver is important. So therefore program inputs and activities ideally should also have some indicators, right? Are your indicators properly defined? Can the data related to indicators be realistically collected, right? Do you have some process indicators? If you're looking at, outputs and intermediate outcomes, you need indicators for even that, because until unless you're not tracking the intermediate indicators, you cannot hope to achieve the ultimate impact. Okay, your indicators, are they sensitive to change, right? And you can't have too many indicators, but at least try and ensure that you have 1 to 2 indicators for every core activity and outcome. Okay, and your indicators, right? If you are looking at overall outcomes and impact, right? Your indicators should actually be able to reflect that. And for that, again, go back to your theory of change and see, how your intervention is being, to see what is it actually that you are doing and what is it actually that is going to bring change in the lives of your participants. Okay. Ideally, the data should come from a variety of sources, right? Indicators involve everybody in the process. Compare your indicators to other interventions. Ensure that these indicators are vetted by donors, research and subject matter experts, right? Sometimes, like if I am talking about, health or a water or a sanitation, right? Good idea to have some subject matter experts to also deliberate on that. And of course, disaggregation, okay? So in terms of process, okay, the process should result in more realistic, meaningful, and achievable indicators than those set down by top-down method. So it should not be a top-down method. It should be a bottom-up approach or a combination of the two at least. Okay. And look at different needs. Like, so at every level, I would have, every person has a different need. So my donor will have a specific need. My program people will have a specific need. My communication team may have a specific need. My community groups may have a specific need, right? My field staff may have a specific need. So you have to look at what each one needs. Okay. So you know what is measured and how it is measured, but you also have to decide who is deciding what indicators are important, right? Because if you are only focusing on 1 or 2 who's, then, it doesn't really give a sense of like it doesn't really set well with an organization growth, right? Everybody has to be involved. Okay. important that, why and how the changes happen. And for that, qualitative, right, is also important, and how important that change is to those affected, right? So if you're doing that, then that is also important. Okay. Community ownership, ultimately the idea is that if you can enhance community ownership and involvement in projects, awareness or learning, that's great. And if your indicators setting process can help you do that, then that's the best thing that you do. And wherever, whatever, please do provide disaggregation for gender and other marginalized communities, because we all know that reach and impact impacts different people in different manners. Okay. And you may be giving one single intervention, but because there are power dynamics, and so therefore some people get some things more and some people do not get as much, or are not able to benefit to that extent. So if you do disaggregation, you will be able to understand why and how some people were relatively left behind. Okay. So this is the end of my presentation. Okay. Vaishali, can we do that indicator readiness thing? And then we'll go back.
Yeah, we can, but there are some questions, if
Okay.
you can answer those first. So one is, of course, so there are two project-specific ones, but then before asking that, there is just one question on how to measure confidence building, right? You can answer that.
Confidence building. Again, as I said, confidence in what context? Okay, so even if you are saying confidence, let's look at the program, let's look at the intervention, look at the audience. Okay, now whether it is children or adults or women, okay, so everything has a context. So I can't give a off-the-cuff remark until unless I look at the context in which it is done of the intervention, and what is exactly the intervention that is done, and what is, when I say confidence, what exactly in terms of confidence, right? Like confidence in terms of reading, writing, right? Speaking in front of a stage, right? What confidence, right? So you have to interpret that confidence, right? So confidence can mean different things for different organization in different contexts, right? So that context is important.
Yes. So it is an education project which Manoj sir is sharing. I'm just going to put all the questions. Maybe there may be similar threads that you can answer. One is, of course, also like Madhvi has just asked, in the educational field, how to measure if the children understood the session we deliver. Right? Again, something that everybody might be facing. So yeah.
So you can either, in that sense, whether they understood or not, then in that case, you have to provide for some sort of feedback, which you need to take, and, provide for some element of feedback, and which is in context to what you have delivered. And that regular feedback session is important, right? So whether it is a structured or an unstructured feedback session, then that's a different thing. But yeah, it has to be done.
Yeah. So there are two questions based on, one Shubhra had asked. So this is from Project Second Chance, where they work primarily in setting up prison schools, right? So that inmates in prisons can be engaged in reformation and rehabilitation through legal literacy, well-being, and gender sensitization. So how do they think of indicators in this setting where the intended impact is on both the prison system and society at large? Like this is their intervention, and
I think, rather than, rather than me and you asking, actually, you should ask the participants who are part of that program. Right? And interview them and see, how they look at the program, and then also talk to the families of those participants also, right? Because that will give you a wealth of information, is that how it changes them, and how, because at the end of the day, why do you put people in prison? At the end of the day, it is because you want to reform them, and you want to reduce crime, right? So you want to ensure that these people don't return to a life of crime, and they find alternate employment, and they are treated with respect, right? So whatever was done, they committed a crime. At the end of the day, we don't keep treating them as criminal, right? So from that point of view, if you look at it, then your indicators will obviously flow.
Yeah. Shubhra, feel free to respond to that or ask a follow-up question. But yeah, I think.
Yeah, just wanted to share. Yeah, Vinti, thanks for addressing that question. And yeah, I think most of the times when we are running these interventions in prisons, of course, we run workshops, there is baseline, endline that is happening, but then there is a larger cost saving for the prison as an institution also, because people are not coming back into the institution, right? My question was intended to sort of understand that how do we sort of make indicators to assess the larger impact that we are making, which means that maybe tracking some of the participants beyond once they move out of the prison as well, like how they're doing in the community, right?
So for that, if you can keep data, it's very important that, you are going to keep data, right? So you can track the patient, everything, but provided, you have a program which keeps them, you keep in touch with them. Then you can collect data. Otherwise, if you're looking at impact on society, if you don't collect data, then it is very difficult. Right. So for example, I came across a very similar question in different contexts, is that, see, there was some, palliative care, training that is provided, and they were, trained to work with volunteers, with whatever patients who are terminally ill. But at the end of the day, right, if you're not keeping a track of the volunteers after they have graduated, as well as, with the patients, how do you really say that your training program has been effective? For all you know that you have just trained people have said, okay, feedback is great, but you don't know what is the ultimate impact on the society, because you haven't tracked the ultimate patient who is the, who is really gaining out of that treatment, and whether or not, the financial toxicity is increased, and the burden on society in terms of caring for those patients has not really, been factored in. Right. So in that sense, you could, also look at whether, they were, involved in crime, or, or they were, involved in some other society enhancing activities or society benefit activities. So there is always something that you can do which is feasible and which is collectible.
Got it. Thank you, Vinti.
Exploration, yes.
Thank you.
I know that some of you are working on very complex things. But yeah, I think just holding on to what is in your control and what can be measured feasibly is an important lens. There are a few questions on validity or how to make sure authenticity. Before that, just one more question which has come from Mukta Charitable Trust that runs a mental health helpline, where, a lot of the work is anonymous, right? And so they're asking to get some, we do take feedback. So to get some input from them, we are taking more detailed feedback and in the process of finalizing questions, right? Now, since the questions also shows outcome at a level for them, it's an indicator. They want to understand if the questions or contracts they're using, should it already be standardized, or if they're using non-standardized, what should they have to do for it?
Non-standardized, see, the problem is if you use non-standardized, okay, so in pretty much this case, as I said, I have to actually look at the intervention more. But on the cuff, just over, I can just say that you should try and use a semi-structured instrument. The reason why is that if you do a totally unstructured instrument, it's going to be very difficult to carry out, because very difficult to code. Okay, so use semi-structured, some rating scales, then use a unstructured question, which can be also coded. Right. So that unstructured part can give you a better indicator in terms of how actually, from an individual perspective, how each one is benefiting. See, I may give standard questions. Sometimes the standard questions do not cover the entire universe of what our responses can be. So if you have an unstructured question, then it gives more leeway and more room for people to express what they actually feel. Right. We are all distinct individuals and with distinct needs and distinct, responses. Okay. So one size fit all does not always work. So sometimes you also need, that qualitative question or an unstructured question, which really allows the person to express what the person is really feeling about the session. Okay. Yeah. And that can be always coded.
Yeah.
Thank you, Vinti. That's really helpful. Yes. Thank you, Vaishali.
Great. At this point, I think it's also relevant to what Sachin asked. How can we assure the authenticity of self-reported data, right? I think, again, something that everyone must be dealing with?
It's a very difficult, I mean, as a person who has been collecting data and right, so you have to devise your instruments really well. Okay, so there's a lot of effort goes into devising questions in a way where people don't give rehearsed answers, right? And they don't give answers just to please you, right? So there's a term for it which I'm forgetting at the moment at one time.
Social desirability.
Yeah, desirability, which is like, okay, they'll give you something that, okay, when you want to hear. Okay, so and there are always ways, like, so for example, one is ensuring that you ask a question in a sense which is like a counter question, and cross check that question. Okay, so not possible for that person to because the moment that person answers in that way, the next question will actually so you have some logics built into it, and that kind of helps to do it. So
I think
instruments design is a very important facet to check authenticity. One of the ways, of course, it doesn't solve for everything, but yes, to a great extent it does.
But there will be always latent meaning, and the actual meaning will be.
So with that, you need to do pilot testing. Okay, you have to run your questionnaire first, check it at your end, look at if it's culturally appropriate, see if it is not too long. Then you pilot it, and then you ask people. Then you, even for the people who are going to conduct it, then you ask them to kind of ask. And so even when you are doing the training, then also they have to ask and they have to answer, right? So from the ends of both, the training is conducted, so that subjectivity in terms of what you are asking and what the other person is answering needs to be at the same level, right? So that dissonance needs to be reduced as far as possible. And again, that is again a time-consuming activity, and needs to be, you need to be careful on that also. But yes, the point that you make is really valid.
Yeah, great. I mean, like, I think, Sujata, your question also gets addressed here, right? Because similar question had come that if you work in the long term, people get used to answering the questions.
Yes.
And that they may say that there is a change, but then there isn't. And so the question that Sujata is asking, how to deal with such issues in assessment.
So there are, as I said, sometimes you don't just look at, you may look at focus groups, you may look at other ways to collect data, and don't ask the same participants again. You can look at panel data.
And also, I think what you mentioned earlier, right, ma'am, triangulation of data.
Yeah.
Essentially, अलग-अलग जगह से, अलग-अलग तरीके से और अलग-अलग जगह से same चीज के लिए check करना.
हाँ, वो क्या करते हैं, I'm replying in हिंदी, क्या करते हैं क्योंकि उनको डर लगता है कि अगर वो गलत बोलेंगे तो आप उनको सर्विस नहीं दोगे. Just to ensure that कि वो सर्विस कंटिन्यू करें, तो वो बोलते हैं हाँ नहीं सब अच्छा है, everything is good.
Right. Yeah. Thank you. That helps. Thank you.
Yeah. एक और सवाल है कि if we need to select sample to check the outcome and impact of the project, how much percentage of data should be considered? Shweta has asked.
If you want to?
So basically, if a sample has to be collected, what percentage should it be?
No, I can't answer that question unless I know the intervention, and I don't know. And the sample size calculation is again, you have to look at the variables and the questionnaire and then look at the sample. Right, so there are sample quantity of sample is again needs to be worked out. True.
I think there are just two more questions. One is, of course, an easy one, and also just wanted to tell everyone that there is an indicator checklist that we're going to run soon, a form. So do stay on, and if you need to, then I'll also share the links in the chat box and on the email. But there are two more questions coming in, ma'am.
Can we just put that indicator thing while people are answering?
Yeah, I'll do that. Are there any softwares to process data which are cost-effective solutions? So that is something that is coming up. And another question, Pavandeep, I can also ask you to unmute and you can ask. We do have time.
Hello, ma'am. Yeah. So, ma'am, we are doing different interventions, obviously, for one common impact. So there are different pathways we follow for a common impact. So in terms of, setting up the indicators at various level, so are there different indicators for these intervention at output level? Impact is same, with all the intervention, impact is going to be same. Outcome to large extent. So there will be different output indicators. Is that the correct way to see it?
Probably if you are looking at your outcomes are different, but there are different pathways to it, then possibly you will have different outputs also.
Sure. Thank you.
So regarding software, I mean, see, R is the most, R and Python is the most processing data. Then, I mean, Stata and SPSS are expensive. Okay, but you have even graphical user interfaces developed of even on which are run on R platforms like R Commander and JASP, which are also there. Okay, so those are also there, which can also be used to kind of process data. Okay.
Great.
So this
I hope Manoj, you got
checklist is like, I'm just saying, it's just something that, I design, and, just like, if you kind of give your email, so you will get a copy of your responses. Okay, so the idea is for you to, it's for your own benefit, like, for you to kind of mull over in terms of like how more work you need on your indicators, right? So I'm not asked for your name or organization or anything. That's all. It's something that it's for you to kind of, it's like a feedback in a different manner, right? The whole intention was that this session must be really useful to you.
Yeah. And there are, ma'am, in the chat box, there are a few appreciations also coming in for you. There is more space for questions. The indicator checklist has been shared. The feedback form also has been shared in case you are planning to leave a little earlier. Please do fill that out. And as we're discussing about the indicators, we do rely on your honest answers. So please do share your feedback. Apart from this, all the resources that have been mentioned, like the OECD DAC framework, the HDD indicators, I'll be sharing that in the post webinar email. But yeah, there is space for more questions, so please do ask. I know a lot of information has come through. You must be processing it. But yeah, we're here for some more questions.
Yeah, please go ahead and ask questions. I mean, right, and of course, Vaishali will send you a contact forms if anybody needs to get in touch with me. Then so I'd request you, Vaishali, if you can just send in that contact form. Okay.
May I take the opportunity to just ask a question? I've unmuted myself.
Of course.
So we are closing a mental health project in Mumbai. And because it was one of the first that we were doing ourselves for the first time in a community urban slum here, there were multiple activities linked to the objective. I know far more now in 3 years about what a theory of change and LFA is. But now that we are closing it, year 1 was different. And now in year 3, we have made it far more clean in terms of properly putting the LFA in place and tagging the activity to the output indicator, to the outcome indicator, and then to the impact that we are wanting to do. And one of the, for the context, because that's what man's been asking, it is like, was there stigma reduction in the community by the awareness programs on mental health? And this was not for a specific age group necessarily, but across. So it became it's a wicked problem that had a very tricky indicator. How do we map? And one of the errors I realized, ma'am, we made is that there was a confusion because we knew little. And so we started taking feedback for each session, saying, how's the session? A friend asked that, how do you know if a session is effective? So we have feedback, but that's for the specific topic. So what I've understood, and correct me over here, a feedback form, it is a feedback form. It cannot be tied into the indicator. Is that what are we saying? So then I have to have a different process, outcome indicator.
So if you're looking at only whether the session was delivered or not delivered and whether people understood or not, and then the feedback is in. But for example, as you said, right, like the stigma attached, okay, then for that you need to probably have a survey or something that's what where you say that, how easy was it to talk about this, right? And, if you are having like X and Y or Z, right? How would you, kind of communicate this, or would you be able to go to a psychologist or would you be able to discuss it with somebody? So those kind of questions is there. And this is a real problem stigma is a real problem. Okay. So, even to be able to talk about people's mental health, okay, and to be able to distinguish between what needs attention, okay, and how is it affecting your productivity and efficiency and your capacity to even have normal relationships, okay, then that is something that you have to assess.
So now as I'm going to change and I will take less time, now that we'll go for another cycle of a project, maybe design something different, what I'm learning is that from the beginning only you prepare a baseline.
Yes, absolutely. Absolutely, right. And this is one of the biggest problems that we kind of do, is that at the end of the program, we want to do evaluation. No, evaluation has to be fed into the program design. And it needs to start from day one. Right. So if you know where you are going to go, you want to go where you, whatever, decide where, where you want to reach, you have to, measure it like in terms of right in the beginning. Right. So how do you know that where you reached or not reached in that direction, right? So you want to go to space, but then, whether you've reached space or not, you need to figure it out, right? So that you need some sort of an instrument.
Got it. No, I'll connect offline to understand this more from you.
Yeah.
There is the contact form will be shared for Dr. Hilti, and I think, yeah, please do reach out to her. Amazing. I think some of you have also gone through the indicator checklist. You can also keep referring back to it every time you are creating your frameworks and your indicators and your systems. Awesome. I'm just checking. I hope we've answered all questions. I think we have that were there in the chat box. If there are more coming in, please do ask. Otherwise, yeah, I mean, we'll stay on for 5 more minutes or so. Okay, we have a question from Dhriti.
Shall I just put the contact form, right? So then I can actually,
yes.
kind of write back to people.
Of course.
That's with them.
Yeah, and Dhriti has asked a question. I think it's a. One second. Yeah, Shubhangi, that's a really great way to remember that. So Dhriti's question is, when you recommend using semi-structured questions for mental health or having a base and end line, what are your thoughts on these kind of questions, right? Did you feel heard in the session? Or another question like, do you feel we worked on and talked about what you wanted to work on and talk about? And a third question that could be, on a scale of 1 to 10, how distressed do you feel at the moment? If we ask that at the start and end of a call, would that work?
Okay, so here is like, did you felt heard in the session is fine, right? And like the second question, I mean, I understand what you mean, but I think that the length of the question is too much. You will have to make it more brief, okay? And, and the third question is how distressed. Now, I'm not very sure whether that is appropriate, because you don't want to ask a person how distressed do you feel. Right? I don't know whether that can be triggering or not. So we have to, actually figure that out and, see if it's comfortable to people to ask questions on, distress, right? Or you need to reword it in a different manner so that it doesn't ends up at distressing to the participant.
Another thing is, if it's a helpline and in the beginning, how do you ask that question when they are waiting to, get something addressed?
Sometimes, and then I'm saying that yes, baseline and endline is important, but sometimes, sometimes in some corner, it's the baseline is not possible, right? You have to deliver the service and people don't want to answer the question at the beginning of the session. They want to have the session. After the session, yes, they'll give you a feedback. But it's like Amazon asking you that, okay, rate Amazon before you get the product, it sometimes may not work. So sometimes, the feasibility of when you are going to ask the question and how comfortable it is for the participant to answer it is also to be taken into account.
Yeah, I just wanted to add on that it depends on situation also. Like if that person is having some personal issue, he will say, I am distressed only.
Yeah, that's true.
Right. So for example, I mean, there was one question that, we're talking about palliative care, right? So in a person is in a terminally ill stage, right? So I can't have a baseline and endline for palliative care. I mean, at the end of the day, I am only assuaging some of the symptoms. The person is not going to get well. Probably, and some days he's going to feel worse. Right? There are days when you feel good and there are days when you feel bad, but it is not a reflection of the strength of the program. Okay, so you kind of need to understand what the nature of the program, and you also have to convince the donor also that look, this is what it is, these are the intricacies, these are the assumptions, these are the challenges, these are the issues, right? And it has to be a conversation.
Yeah. The strength of the
we
program.
figure it out. I mean, I'm sure there is always a way to figure out the strength of the program, but yeah.
I know. I think
I just wanted to add, one way to go to for this solution is do a research, as we said, do a research and find some similar questions or frameworks based on this health or mental.
Sometimes you can actually look at it in terms of when you are designing something. So sometimes you look up questions, you research, and then you adapt it as per your cultural context, and then you see, right? Many times, we do telephone questionnaires. Now you can't have 20 questions in a telephone questionnaire. You can have only 4 or 5. Okay. Otherwise, people are not going to answer it. So you have to select the best things which will give you, right? So even the instrument design in terms of the, participant, time, place, everything is important.
Great. Thank you so much. This was, of course, I think when we were discussing, Dr. Vinti and I, we deliberately chose the title as the tricky path to devising indicators. And we know it's much easier said than done. But I hope that you have some frameworks, some resources, and some more confidence in building your indicators. I've shared the contact form for Dr. Vinti. I'll also share the recording. And do go back to it. I'm sure that once you work a little bit more on your systems, you would want to go back to the checklist and this recording itself. And thank you so much, Dr. Vinti. I know that you've prepared so much for the session and you took out time from your extremely busy schedule. Thank you. Thank you. This is what makes Atma webinars also a special place. And thank you to everyone for joining and, as always, staying engaged. Brilliant. See you next month.
Okay. Thank you. Thank you, Vaishali, for giving the opportunity. And thank you to all the participants for asking questions, for being present, right? For being interested in the session. Okay. So it works both ways. While I enjoyed living it, but at the end of the day, it has to be useful to all of you. So thank you very much for being a lovely audience. Thank you so much.
Thank you.
Right. So